The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference.
I'm Susan Brender, and this is the Susan Brender Show. And I've had a guest on my show before. Her name is Renee Balcom. Now, the interesting thing that she does, she navigates, and she is a health advocate for so many different people. And that is so important, especially during these times, because people are left alone. There's so much loneliness that has really prevailed because of the COVID. And now you have somebody like Renee who helps these people, that really in many different ways. And that's my question to you, Renee. How do you help these people?
Well, Susan, first of all, thank you so much for having me back. I always enjoy your program, so I appreciate being here again. As you mentioned, I am a professional healthcare advocate. And so one of the things that we do is we assist people in navigating the healthcare system as well as their benefit system. So we've all had that experience where maybe we're sitting at the doctor and we just feel like we're not being heard, or we get in our car and think, shoot, I should have talked about these things, right? So my work and our work as healthcare advocates is we go to those appointments with our clients and we assist them in making certain, number one, that they're heard, and number two, that they're getting all of the information back that they need. And then we also work with their benefits program. So we, procedures that are denied, we assist in preparing all of the documentation that's needed to get a procedure paid for through the insurance programs.
Now, one of the things that I find very intriguing, let me say intriguing, is the fact that there are so many people, as I said before, alone. They lost their spouse, they lost their brothers, their sisters, and they're all alone. And it's such a scary thing. So how do you deal with the mental side of the story? In other words, you help them physically, go to a doctor or do different things, but there's a mental issue going on here. And I think it's a really important thing that it's dealt with. So how do you do that?
Well, I appreciate your question so much because you're absolutely correct. In fact, statistically, in the age group 65 and over, 1 in 6 people are never married and they do not have children, which is a huge number when you really think about that. 1 in 6, that's a lot. And you're correct. The pandemic left people very isolated and very alone. And so a lot of the work we do is companionship, is being available to, talk to our clients and help them understand maybe what's going on with them physically. Even medicine was not very generous during the pandemic because many people that were isolated, most of us were relegated to televideo calls with our doctors. And I don't know about you, but I'm not that great at technology. So to kind of sit in this blank waiting room on my computer waiting for my doctor to show up definitely can be a lonely place to be. So what we do is just try to offer companionship and supports, help people learn how to navigate through the technology systems, but more importantly, really work to get them that face-to-face appointment and meeting they need with their healthcare specialist, whatever that may be. Could be their dentist, it could be their psychiatrist or their therapist or their doctor.
All right. I'm interested in knowing a little story that you probably have of a person who really said to you, I want to thank you so much for helping me because without you, I don't know what I would do. So there must be a story that you can tell us. So if you would, tell us a story, please.
Well, thank you again. I appreciate that question. So one person that comes to mind, speaking of the isolation, is this amazing lady that I met. Her name was Betty Smith, and which was her real name, not making that up, Miss Betty. And a neighbor had kind of been looking out for Betty. And then when COVID hit, she just felt that she didn't want to risk going and seeing her or having her, taking her out and some of those things. So she informed me about her, and I called Miss Betty, and she was eager to see me, and we all wore masks and all that. But I went to see her, and one of the things that was just really interesting about Betty, so she's 91 years old, and Betty served as a nurse in World War II, and she was out on the combat fields, and she was a part of the nursing team in the war. So she was a vet, and her husband had died about 5 years prior. So she had been by herself for quite a while, and she'd been by herself pretty much through the pandemic. Miss Betty had not left her house in 3 years.
Oh my
And
goodness.
she definitely needed to have some medical care. And so I sat with her and was talking with her, and she was on a fixed income and had some other issues. There were stairs going in and out of her house, and she wasn't comfortable maneuvering the stairs, and some of those kinds of things that we talked about. And then she asked me what my fee was, and I told her, and she said, "Oh, I could not pay you. Like, I can't, you have to leave. I can't afford you." So, true story, I went out to my car and I started to cry. And
Oh,
I just felt like, everything can't be about money, right? This woman, proud, amazing American woman, a leader among women, right? I went back to her door and I asked her if she could speak with me for a few more minutes. And she said, of course. And I went in and I said, Miss Betty, can you please let me serve you at no expense to you? Because I feel like you served in the military and you've done so much, and it would just be my honor to help you if you'll let me. And so she kind of reluctantly agreed. She's a proud person, right? And so we started our journey together, and it really was something. I was able to get her out of her home, get her to the doctor. She definitely needed some medical attention. As an example, she had not had her toenails done in over 3 years, and she couldn't manage them herself. So you can imagine things were definitely in need of care. And so we went to the doctor and we started getting her the care that she needed. And, to kind of make a long story short, we were together for about a year. But in the meantime, I was able to help coordinate county services, her own medical service team, right? I reached out to their social department, and was able to get her some care supports there. She was eligible for some other, because she had served in the military, she was eligible for some veterans supports. And we were really able to dial Miss Betty in and get her completely equipped with, a whole plethora of care services, including a little housekeeping and some cooking and some other things that she needed. So it was a great privilege of mine to serve her. She's now passed away, but it really, really was such a gift to be invited into her life and into her world.
Renee, it's very interesting that you're talking about this, because I was going to even ask you the question about veterans.
Mhm.
Betty was a veteran, and there's probably not a lot of women who were left alone who are veterans. But if they are, doesn't the Veteran Society, or whatever they call it, don't they really, give people money to help them with all kinds of issues?
There are definitely benefits available depending on your service, and kind of what the details were of your service. But there are veterans benefits available for anyone that served, and they called them aid and attendance benefits. And then there's just also a huge assortment of benefits for veterans. One of the things that people don't realize, though, is that VA services and VA medicine are two totally different organizations. So maybe you're going to the veterans medical and you're getting medical services there, but you're not pursuing some of the other benefits. So one of the things I always encourage people is to understand that those are two different application process and two different organizations. And if you're getting one or the other or not getting either, you should definitely pursue VA services and VA medicine, veterans medicine.
And what about disabilities? A lot of people who went to war, even people now who went to Afghanistan, Iraq, Iran, they they need help. There's no
Mhm,
question about it. And the
mhm.
fact is, aren't they eligible for disabilities?
They may be. It depends on what their experience was and maybe what happened in their service, but it's definitely something that I think first of all, I believe personally that every veteran that served should be eligible for benefits. Every single one of them. I don't care if you were sitting in a desk in Honolulu, you served, right? So I feel like, and unfortunately, my belief isn't, held true throughout the services organizations for the VA, but I think every veteran should step in and try. And every county in the United States is supposed to have a veteran service officer, so VSO, and that's Victor Sam Operator, so veteran service officer. And every single person that has served in the United States military in any branch should reach out to that county officer and find out what their eligibility is.
Now, another thing that's also a problem is sometimes people do have children who actually would love to help their parents, but they live in different places around the world. We live in a society today where the family unit is so different the way it was when I was a kid. Now, what's happening is that they live in California, the mother lives in New York, and they can't get together to help them. Do you intervene in something like that?
Yes, yes. In fact, I have a lady here. I'm in Sacramento, California, and I have a lady here, and her family is in the UK. And so and she doesn't have any living relatives here whatsoever. So myself and another one of the healthcare advocates that are on my team, we really are her family, and we're her support for her. She lives in assisted living, but we help her with every aspect. We take her shopping for clothes, we take her to the dentist, we make certain she has the snacks she likes, and we just completely wrap our services around her because there's no family available to do that.
Yeah. Now that brings me to also asking you about grandchildren.
Mhm.
I know I have a 3-year-old grandson, and when I see him, I can't even tell you how I feel. He is just so wonderful. Now, I'm not talking about a 3-year-old, but if they have a teenager in their family, don't you think that they can help them as well? And can you assist them in learning how to do that?
Yes, absolutely. And in fact, it's so fun to do that. If we have a grandchild, and maybe they're 14, but they know how to maneuver, say, a tablet, right? And they can sit with their grandmother, their great grandmother, grandfather, and show them old pictures or old movies or whatever that technology can show them. I have seen, these incredible interactions with the younger members of a family with an elder, and it's enriching for both parties, right? The child is learning a lot from grandma, and grandma's learning from that kid. So my children, I have adult children, 29 and 30, but they come, and my mother lives with me. She's elderly, and they come and visit her, and watch The Bachelor together or whatever. They have their shows that they like to do, and it's just such a heartwarming and amazing time for them. So I encourage that in every family. And frankly, there's a lot of adoptive grandparent programs throughout the United States where it's healthy for a younger person to adopt a grandparent and go into some of these facilities and help and be available to some of these people that don't have family.
And what about animals? It seems to me that animals are also almost like a child. And I know that people love having animals, and I'm talking about dogs and cats. And do you encourage that? And, how do you do that? Do you go to a kennel, or how do you get an animal to be a friend of an elderly person?
Well, there are programs that you can have people come in and bring their animals, but I'm an animal lover, cats and dogs, and I believe that an elder that lives alone could definitely benefit with an animal. And again, we bring services in where we help take care of the animal for them. If they can't walk the dog, it's not expensive to get a dog walker or hire a kid, a neighbor that's willing to take the dog for a walk. Cats are so much easier, but managing their litter boxes for some of our seniors can be difficult at times. So part of the healthcare advocacy that we do is we have a service that we take care of those kinds of things for our clients. So yeah, I encourage that relationship. I have a dog that I adopted a few years ago, and he's my constant companion. He's sitting across the room from me right now.
Yeah, it's another thing that people, they live alone. Now, here's the thing. I want you to walk me through the steps of how you begin to become an advocate for people, okay? Because there is probably a way that people can find out about you and also work with you. So start from the beginning.
Okay.
Tell our audience exactly what happens when they find you and now you're going to give them help.
Okay, thank you. Oftentimes, someone decides that they want to be a healthcare advocate because they worked with one of their parents or grandparents, and they found that serving this family, or maybe they even work with a child or an adult that has some physical limitations and some disabilities. So they were found that it was such an enriching experience that they decided, like, you mean I can make money doing this, right? So, and they find out that there are professional healthcare advocates. And in fact, there's a National Health Advocacy Association in the United States that represents most healthcare advocates in the nation, in your cities and your areas. And we can also take classes. There is a certification program, and there are classes. Certified Senior Authority, a CSA, is a certification program that you can go through to learn about assisting elders or people with disabilities. I actually took one of their boot camps not too long ago, and I have to tell you, Susan, it's an experience. It was 2 days. We had to put cotton in our ears. We had to put like this thing in our nose. So we were kind of diminishing our hearing and our smell, and then also wear a plastic glove on our hands so that we could feel that our dexterity was different. We had to spend 2 days like that in everything that we did, and just kind of start lowering our sensitivities so that we could heighten our sensitivity to what our seniors are going through as they age and what could happen as we age. So it was really, really an interesting experience for me. And I encourage anyone that's interested in healthcare advocacy to check out the national programs or the certifications in your area. And then when someone's looking for an advocate, one of the things I want to make certain that I'm clear about is most hospitals and most large insurance networks today offer advocacy. And those are good programs, and I'm certainly not diminishing them. However, there's a difference in having a private healthcare advocate that is there for you as your person than having someone that's working for the hospital or the insurance company saying that they're your advocate. And the difference is who's paying the bill. So my experience has been, if you're working with a hospital advocate or an insurance advocate, they may not get work as aggressively for you as a private healthcare advocate would, because I work directly for my clients, no one else, and I don't have a conflict with that at all.
Are you covered by insurance?
Yes, I have. So I own my company. It's called Renee and Company, and I have 5 healthcare advocates that work in the Northern California area, and we operate under errors and omissions insurance as well as standard business insurance. Oh, do you mean are we paid for by insurance?
That's correct.
Yes, I'm sorry. No, we are not. It is an out-of-pocket expense.
Now, the government, you fund so many different things. I mean, they spend tons of money. Have you gone to, say, your local congressman or senator and really advocated for the people with them? In other words, saying, people are all alone, as we spoke to before, and instead of always worrying about what's going on in other places around the world, let's worry about our own, okay?
Mhm.
Now, have you spoken to anybody and said, we need to provide a grant or something that is going to really help these people that we are advocating for?
I have, and in fact, I have been quite aggressive in pursuing the state of California. I lived in Oregon for 15 years, so I've been a healthcare advocate almost 20 years now. And in Oregon, I was seated by the governor, Kitzhaber at the time, to write the scope of work for healthcare advocacy there and to put together curriculum for the certification program, which we did get passed through the state. In California, California does not have a required certification program, but I have addressed the administration here a couple of times about bringing these benefits to our seniors. And the solution that they brought here, now California's very liberal state, is that they brought healthcare advocates into county employment. So again, they work for the county, the Health and Human Services Department, and there's a group of advocates there now. But again, and they offer that for free, but it's a minimal workforce for a large community, and they're actually working for the state of California. So so I've gotten myself in trouble because I'm quite passionate about the work that I do, and I think every state's going to adopt this differently. I do believe at some point, as we continue to, this is a reasonably new career path, a new profession, but as we continue to document our successes and show how good it's been for our clients, as well as how cost effective it can be, I think we're going to start seeing the state take on more and more of the expense of advocacy. I do want to add, and I'm sorry if I'm talking too much. I did, at one point, I had a contract in Oregon to work with the Medicaid recipients in Southwest Oregon. And so Medicaid will pay for some of these benefits if the order is written correctly by the doctor. So there's a little bit of support going on in Medicaid. But, we have a lot of people that don't qualify for Medicaid that need the service. So I kind of discount them.
Well, you know something, Renee, you do so much good for the society and so much good for people. I always like to give my guests the last word because we're almost done. So what do you want our audience to know that is something that you haven't spoken about yet?
Well, and again, I'm sorry, I tend to get, I sorry if I took over the program here, but I get very excited about what I do. So one of the things I want the audience to know is that healthcare advocacy does not have to be expensive. If you are dealing with a medical diagnosis that's confusing, or you just feel like you're really isolated in getting that care, getting the care you need, please reach out to a healthcare advocate. And if you want to reach out to me, I can help find one for you wherever you are. And then also, I am working on a technology that will assist families in finding healthcare advocates and finding these supports in your local area. So I was with my developer earlier today, and we should have that app that will be available on your phone or on your computer. We should have that ready by June. So I'm excited about that, and we'll do a national rollout on that product. So. And
how do people get in touch with you if they want an advocate?
You can reach me. My email is Renee, RENEE, at Renee Company, RENEE Company, run that together.com. Or my phone number is 844-661-2369.
Well, my guest today has been Renee Balcom, who really provides a fabulous service to people all over. And if you want to get in touch with her, she said how you do it. And it has been just a pleasure to learn that there are people who care about other people in our country, because we need it. It is just, it's wonderful. So thank you, Renee, for being on the Susan Brender Show.
Well, Susan, thank you. It's really been a pleasure. And I appreciate your work so much. So thank you for having me.